My name is Dr. Akila Prasad. I am the audiologist here at Aspire Audiology and Hearing Center.
Hi, I'm Alli. I'm the patient care coordinator here at Aspire Audiology and Hearing Center.
And we're going to start today's video off by just discussing the basics of hearing loss, when to get tested, and some details that go along with both of those things.
Okay, well, what is hearing loss, Dr. Prasad?
So hearing loss is basically the loss of speech, hearing. Any sound that you start to lose is effectively a hearing loss. But that being said, there's multiple different types of hearing losses. The most common kind we see is called a sensory neural hearing loss. So what that means is there is damage to the auditory nerve. There are microscopic hair cells on our hearing nerve. And once those hair cells die, they can't be regenerated. And that's what causes a permanent or a sensory neural loss. There's another hearing loss called a conductive loss. So basically what a conductive loss is if there's anything impeding sound from entering your ear that's causing you to have a hearing loss. So an excess buildup of wax, fluid behind your eardrum, ear infections, sometimes the three smallest bones in your ear confused together, that can cause sound to not get into your ear the way it's supposed to. That is a conductive hearing loss. A mixed hearing loss is when you have both of those hearing losses at the same time. So there's damage to the auditory nerve. So those hair cells have died. So you have a little bit of that sensory neural loss, but there's also something physically going on, fluid, otosclerosis, something impeding that sound from coming in the right way that's causing you to have what we call a mixed loss. So both of those things together.
Okay. Okay. Well, when do we know when to start getting regular screenings? How do we know?
So generally, we typically like people to get screenings the same way you would a physical dental exam. So with hearing in particular, because the most common type of hearing loss is sensory neural, and the most common cause of a sensory neural hearing loss is age. So age-related factors is like the number one reason why you start to notice that you're having some difficulty hearing. And typically it's just what you would expect. As we get older, the hearing hair cells on your auditory nerve, they just tend to degenerate and nothing can revive them. Nothing can bring them back. So usually we say age 65. Once you hit about 65, you want to get a screening of your hearing every year, annually, especially just to see, even if it's a baseline, just to see what's going on with your hearing. It's good to have an idea, and then you can monitor it annually to make sure nothing's changing.
That's good to know. That's good to know. What's the process of diagnosing hearing loss?
So with seeing an audiologist and getting a comprehensive hearing exam, there's a couple steps that go into it. The first is they will do a thorough otoscopic exam. So they use an otoscope, they'll look in your ears, make sure everything is clear. If you have earwax in there, which we'll get into in a second, they'll remove that wax, make sure that the eardrum looks good, and then they'll do something called air conduction testing. So they will either put earphones in your ears or they'll have you wear headphones, and they'll play tones at different frequencies and at different decibel levels. So the point of an air conduction test is to find the softest sound that is audible to you and at any given frequency. So we test between 250 hertz to about 8,000 hertz.
Wow.
So within that range, we're looking for the softest audible sound. So if you have normal hearing, you will see that your scores fall above the 25 decibel line on the graph. If you have anywhere from a mild to profound loss, your scores will be lower on that graph. So we typically go over the testing in detail once we've completed it, but that's air conduction testing. The second test that we'll do is called bone conduction testing. So we use a bone oscillator, we place it on the mastoid bone, and what we're looking to do there is bypass the natural pathway of sound and just go straight to the auditory nerve. So this is to rule out what we just talked about, that conductive hearing loss. We're looking to see if there's anything that's impeding sound from coming into your ear that's causing a temporary loss. So if we do a bone conduction test and we see what we call an air bone gap, that means there's a difference between the score that we get with the bone test versus the score that we get with the air test. That means that there's something physically also contributing to that hearing loss.
Okay.
The third and final test that we typically do with a comprehensive audiogram is what we call word recognition testing and speech reception threshold testing. So again, we're looking for your ability to recognize speech and differentiate between certain consonant and vowel sounds. So we say some words to you, and then we have you repeat the words back, and we're keeping score of how many of those words you were able to understand correctly and how many you missed. And again, once all of that testing is done, we will go over all of that in detail during your appointment. And then if needed, we do a test called a tympanogram. So basically, we insert a probe into your ear and we put pressure in your ear. And we're looking for a response from your eardrum. We're trying to see how your eardrum is moving. On a healthy ear, we'll see a nice peak. When we do that test, that means your eardrum is moving the right way. If we ever see a flat line or we see some values that don't really match up with what's going on in a normal ear, we will and may refer you to an ENT for further testing.
Okay. Now, how would we know if it's hearing loss, or could it just be wax?
Yep. So great question. And we kind of touched on this earlier, but the first thing that we do at an exam is look in your ears. It could be wax. Your ears, especially if you use Q-tips, which we never want to use, you can push wax very deep into the canal and it can just impact and just compact in there, and it starts to affect how you're hearing. So if I look into your ears at an appointment and I see wax in there, the first thing we'll do is take it out before we do the test. So that is the surefire way for us to determine whether or not the wax was the issue or if there's something underlying going on. Most of the times, to be very frank and very honest, it's never really just wax. There's something else going on, especially when you're having clarity issues in engaged conversation. Because if it is just wax, sometimes you may miss when someone's talking to you because the volume is lower, but clarity doesn't typically seem to be the issue. When you are having issues with understanding speech and mishearing, usually that points to a hearing loss. But again, we always check your ears to see if it is wax. Once we remove that wax, we're able to test you and see what is actually happening and what's going on with your hearing.
Okay. Now, obviously hearing loss is treatable. Is it reversible?
So it depends on the kind of loss you have. If it is a purely conductive loss, meaning there is no damage to the auditory nerve or the hearing nerve whatsoever, then typically, yes, you could have some surgeries or some medications that will bring your hearing back up to where it normally is. If it is a mixed or a sensory neural loss, so there is some sort of damage to your auditory nerve and those hair cells have died, there is nothing that will bring them back. It is not reversible. So the only solution with a permanent or sensory neural loss is hearing aids. That is the only solution to treat hearing loss. We cannot reverse hearing loss once it starts to occur.
Okay. Well, that's good to know. That's very good information.
Yes.
Well, thank you, Dr. Prasad, for answering all my questions.
Thank you. I'm hopefully this was helpful to give you some insight about what the process is, the signs to look out for when dealing with hearing loss, the kind of testing that's required, and then also the treatment solution.
Sounds good. Well, thank you guys for watching, and we'll see you next time in the next video.
Thank you.